Good afternoon, and thank you for joining us for today's virtual media briefing about COVID-19 in London and Middlesex County. We're glad to have you along with us. Also happy to be joined this afternoon by the Mayor of London, Ed Holder, the Warden of Middlesex County, Cathy Burghardt-Jesson, the Medical Officer of Health at the Middlesex-London Health Unit, Dr. Mackie, and the Executive Vice President, Interim Chief Clinical Officer, and Chief Nursing Officer of London Health Sciences Centre, Carol Young-Ritchie. Welcome to the media in attendance this afternoon as well, and we do invite your questions. Just click on the text bubble with the question mark here on Microsoft Teams, and when you do submit those questions, if you could indicate your name as well as your media outlet and who your question is for. And finally, a welcome to those tuning in on Rogers Television, as well as the Rogers Facebook page and YouTube channel this afternoon, listeners on Global News Radio 980 CFPL, and those who are joining us on the CTV London website. Let's get to the opening remarks right away, and we'll start with Mayor Ed Holder. Mayor Holder.
Well, thanks, Dan, and good afternoon, everyone. We've been doing this now, this daily and twice a week press conference. Give or take about 18 months, I think. And, two things are becoming more obvious each passing day. The first is that vaccines work, and they work really well against the Delta variant. Over the last 6 weeks, here in London, Middlesex, despite nearly 300 cases during that time, 93% of the cases involved people who weren't double vaccinated. So imagine, over a 6-week period, we had only 21 cases total. Instead, we had almost that many over the last 2 days. That's the difference between the vaxxed and the unvaxxed. The second thing that's becoming increasingly obvious, and I've been saying this for a while, is that this fourth wave is being driven entirely by those who are unvaccinated. The proportion of unvaccinated individuals getting COVID and being hospitalized here is no different than what's being documented across Ontario, the rest of Canada, the US, and other jurisdictions. The overwhelming majority of those who are getting infected right now are those who made a conscious choice not to get the vaccine. It's apparent, with vaccinations slowing to a crawl, that something needs to be done to motivate the unvaccinated to get their shots. Something also needs to be done to protect those who are at high risk or legitimately might not be able to receive a shot, along with protecting businesses from the risk of additional restrictions resulting from the fourth wave. I am an absolute believer in vaccine passports, and if it was up to me, or if council had the power to mandate such legislation at the municipal level, I'd do it in a heartbeat. Unfortunately, municipalities do not have the constitutional status where vaccine passports are concerned. I am hopeful, however, that the province or federal governments will act swiftly and do what's best, and frankly, what appears inevitable. Quebec has announced plans to roll out vaccine certificates. It's already being done in Manitoba, and we're seeing similar things throughout the world. Regardless of where vaccine passports have been introduced or discussed, there have been significant uptake in vaccination rates in the immediate aftermath. And I sure wish we'd follow suit here in Ontario and in this country. I said earlier, municipalities have no jurisdiction on such matters, but even if we did, we'd require the province or the federal government to issue uniform, recognized, and easily acceptable proof of vaccination documents. They just don't exist right now, but they could be. In my view, we need vaccine passports in the same way to this day require masks in order to access all to services. I'm hopeful the province and the federal governments will act quickly before the fourth wave of the unvaccinated builds beyond our ability to control. And too many lives are needlessly and uselessly lost. That's over. That's enough for me as the good news guy, and I'll pass it over to Warden Cathy, if I could, please.
Great. Well, thank you so much, and thanks for that, Mayor Ed. As always, it's great to be with you. I don't know about you, but I know I'm feeling a little lost today without the Olympics on in the background. What a great distraction it has provided so many of us. And it is always thrilling to watch our athletes push themselves to limits that many of us cannot even fathom. London, of course, was well represented on the podium, and I send heartfelt congratulations to all those who represented community and country. Now, of course, it's back to reality. And we are fortunate enough to see the numbers in the Middlesex-London region remain consistent and flat. And of course, this all has to do with those that are eligible for vaccines in our region and the numbers that are actually getting vaccinated. Those numbers, though, are plateauing as well. As always, I would encourage you that if you know someone who is not vaccinated, share your story as to why you got vaccinated. Make it personal. There is no sense in calling someone out who, for whatever reason, is experiencing vaccine hesitancy. Creating that sort of animosity will not get us anywhere. If you have not received your second dose, please make appropriate arrangements to do so. Pop-up clinics through the Middlesex-London Health Unit and the Middlesex-London Paramedic Services, walk-in options at our mass vaccine clinics, vaccines through healthcare providers, all make it more accessible for you to get your first and second dose. And even though the landscape looks good today, even though we are fortunate to be headed back to the way things used to be, we must be mindful that things can turn very quickly, and the Delta variant does cause pause for concern. With that in mind, take advantage of the incredible summer that we are experiencing and enjoy the outdoors with friends and family as much as possible. Continue to wear a mask and get vaccinated. As always, thank you for doing your part. Remember, we're all in this together, and your participation in fighting the pandemic is appreciated. Your participation in this briefings goes a long way in getting our message out. Dr. Mackie, over to you.
Thank you very much, Madam Warden and Mr. Mayor. Well, we are seeing continued activity, COVID-19, in our community. As you alluded to, Madam Warden, we're not seeing a dramatic increase here. Things have been relatively stable over the past week, but slowly climbing over the summer. If you look at the provincial data, and I'm just going to share my screen for a moment so that we can do that together. This is the chart of cases by day in the province. You can see back in March, April of 2020, the first wave, second wave around Christmas, New Year's, 2020, 2021. The third wave, which peaked in August, and then what is pretty clearly a fourth wave very early, and we really don't know how high that fourth wave is going to go. We will see that continue to increase. I want to so this is case counts per day. I want to also go to percent positivity, which is another very important factor. So this is percent positivity. We know that testing volume is low in the summer, and so we look at percent of the tests that are positive in order to help take out that variable of how many people are choosing to go get tested. We know that people are unlikely or less likely to get tested over the summer when they may be away or engaged in vacation activities. We've also seen a trend where sometimes people who are vaccinated may assume that they don't have COVID and so choose not to get tested for that reason. Really important that people continue to get tested and that we don't assume if we've got 2 doses that we are fully protected. We know that there have been breakthrough cases, and people who have 2 doses can still spread the illness. Much less likely, but it still happens. What we're pointing to here in percent positivity is that increase that represents the early part of the fourth wave. It's more striking here in percent positivity. That means that part of the low case count is because of low testing. If we had the same number of people getting tested as we did a month or 2 ago, our case counts would be higher. So this just confirms we are going into a fourth wave, and it begs the question of how severe that fourth wave will be. If we look back up at hospitalizations and deaths, so deaths here, you can start to see the climb because deaths are usually delayed 2 or 3 weeks. You're seeing a bit of a delay there, but fairly convincing early uptick in the fourth wave there. If you go to hospitalizations, that hasn't seen a big climb yet. ICU is starting to climb. ICU has been a very interesting indicator. You may think that it is delayed to the same degree as deaths, but it is not. There's often time that people spend in ICU prior to passing. And so this ends up being an important marker of severe disease that is earlier than deaths. And so far, from what I've seen each wave, ICU has climbed earlier even than hospitalizations. So there's something really important in the data here. And although the increase is small, you can see an increase over the last week or so in ICU cases. Of course, this is a major issue as we go into the fall, because this will be climbing at the same time that increased indoor gatherings will start to occur with the beginning of school. And then as we get closer to the winter weather that brings us indoors as well. So I'm going to pause on the epidemiology lecture here and just say a couple more things about our vaccine campaign. We have a number of pop-up clinics that are coming online over this week. You can go to healthunit.com to see those. One of the ones that isn't mentioned on our website right now is at St. Mary's School in the east part, Old East Village sort of area. That's an important one because of the uptake in that community being somewhat limited. And so we're going to get the details of that clinic and plop it right into the chat, and then update the website as well. And that's on Wednesday of this week. Dan, pause there. Happy to pass to Carol Young-Ritchie for the perspective from LHSC.
Great, thank you, Dr. Mackie. And good afternoon, everyone, and thank you for having me again today to provide an update on the COVID-19 situation at London Health Sciences. As of this morning, we are caring for 7 COVID-19 positive inpatients, with 5 or fewer of those being on our critical care units. Happy to report our outbreak on B7200 at Victoria Hospital was officially declared over as of last Friday. I'd like to, I'd like to take a quick opportunity to thank staff and physicians for their adherence to the enhanced protocols which contain the outbreak to less than 5 cases in total and brought it to a swift resolution. Last week, we shared with our teams and our academic partners that as effective of November 1st, we will be requiring all unpaid students wishing to be physically on site at any of our hospitals or facilities to be fully vaccinated against the COVID-19 virus. This measure will not only ensure that students will be able to get the most value out of their learning experience by being in person in a clinical environment, but also help with interactions and make sure that our hospitals stay as safe as possible. As of this morning, 7 a.m., our overall hospital occupancy was 92.6%. Our critical care capacity at University Hospital was 82% and 84% at Victoria Hospital. We have previously shared it's our goal at this time to maintain our hospital occupancy at approximately 90% to ensure we have enough capacity to respond to the pandemic as we need to, and while meeting the needs of our community at the same time. So thank you, and back to you, Dan.
Thank you very much, Carol. Thank you, Dr. Mackie, Warden Burghardt-Jesson, and Mayor Holder. We're just getting those details for the vaccination clinic, the pop-up vaccination clinic that's happening Wednesday at St. Mary's School, and we will drop that into the chat for folks this afternoon. Speaking of that, we do have a lot of questions already in queue, so let's get to those right away. The first, Carol Young-Ritchie, is for you, and it comes from Jennifer Beeman at the London Free Press. Jennifer asks, why are students at LHSC being targeted for mandatory vaccinations, but not other staff at the hospital?
Thanks, Jennifer. First, I'd say we're not targeting students. What we really want to do, and our goal is to make sure that our hospital is safe for everyone who comes here, and that includes our students. So we are asking students to be vaccinated 100% by November. At the same time, we're working with our staff and our physicians to raise our vaccination rates. So we have a number of campaigns underway within the hospital, helping our staff and having our staff and our physicians, making sure that they're getting all the information they need to make their decision about vaccination and making vaccination very accessible to the hospital staff and physicians.
Thank you very much. And Jennifer does have a couple of follow-ups for you, Carol. Jennifer asks a follow-up, what percentage of LHSC staff have had at least one dose of COVID-19 vaccine? And do you also have the number for 2 doses?
Yeah, I do actually. So we have the number for our staff and physicians for first dose is at 69%, and that's self-reporting. So as soon as our staff or physicians go and get their shot, they report that to us. So that's for the first dose, 69%, and 62% for the second dose, again, with self-reporting. So what we also are rolling out at the same time is our campaign called Get Vaxxed. And tell us about how you've been vaxxed, and it's an education learning module. So we are asking physicians and our staff to do that, and we hopefully will have more accurate numbers on that, but we think our rate's a little bit higher than what I've reported.
Great, thank you, Carol. And I am going to pause on the questions just very quickly to mention that the information for that pop-up vaccination clinic at St. Mary's School has been added to the chat. And for those folks who are tuning in and don't have access to the chat, I'd like to let you know that the vaccination clinic is happening tomorrow. That's Tuesday, August the 10th at St. Mary's Catholic Elementary School, 347 Lyle Street in London. And it happens from 1:30 in the afternoon to 6:30. And that is a clinic for both first and second doses of the COVID-19 vaccine. So thank you very much for that information. And let's go back to the questions. Another question from Jennifer Beeman. And Carol, this one is for you. LHSC has been awaiting provincial guidance on mandatory vaccines for healthcare workers. But University Hospital Network in Toronto decided to implement a policy themselves. In the absence of a ministry directive, would LHSC mandate COVID-19 vaccination for its staff?
No, at this point, we're not mandating COVID vaccination for staff. We are part of the larger health system, so we are looking for direction from the province if we go that direction. What we are doing, as I said earlier, is we're really promoting education and opportunity for our staff to get vaccinated and reporting. So that's where we're at right now. And again, if we would go to a mandatory, we see that as part of being a provincial direction that would be coming down.
Thank you. And one final question for you, Carol. Approximately how many students will be affected by this vaccine policy at LHSC?
Yeah, the students affected are unpaid students. So it fluctuates a little bit year to year, but it's about 2,200 students. And that includes some of our medical students. We also have a lot of nursing students and some of our non-medical students. So it's about 2,200 for this year.
Thank you very much. Let's go to the next question. Dr. Mackie, this question is for you, and it comes from Jane Sims at the London Free Press. Dr. Mackie, could we get an update on the thawed Moderna doses? How many have been used up? How many do you anticipate will have to be dumped? Have people been taking Moderna, or are they requesting Pfizer instead? Are other health units bracing themselves for more vaccine dumps?
Yeah, thanks for the question, Jennifer. We don't have a lot of update at this point. We're still working through the doses. Lots of people are accepting the doses. We're intensifying our outreach campaign to try and get more doses to more places. We're working with partners to see who else might we vaccinate. How can we work together to get those doses out the arm, into arms, out the door and into arms. And I actually don't anticipate that we'll have an update in real time. Once the expiry date has come and gone, we will do a hand count to know exactly what is left as part of our process of reporting up to the province.
Thank you very much, Dr. Mackie. Let's go to our next question. It's a follow-up from Jane Sims. This one is for Mayor Holder. Mayor Holder, for a year and a half, there's been no Sunfest, Home County, London Nights Games, Grand Theatre, Rock the Park, or any other kind of festival. However, London is basking in a gold medal moment. How and when is the city going to celebrate London's Olympic athletes? Where will it be, and what protocols will be in place to make sure everyone is safe?
Well, hey, Jane, it's a great question, because when you look at the results that London has had in these Olympics, we're the greatest city in Canada in terms of turnout for gold medals. Phenomenal. And when we look at the world-class athletes, you mentioned the Knights and the world-class athletes that we produce in so many ways, in hockey, baseball, soccer, it goes on, basketball, it just doesn't stop. So let me amend a little bit what you said there. Firstly, we have had a festival, Ribfest, and it was successful. It was safe. In fact, we had a pop-up clinic right by the entrance there, which helped generate some additional interest and activity. And we were pleased about that as well. And while we've not had Rock the Park, the organizers there have had some dinner engagements where we've been able to allow them to host upwards of 100 people at that time. Now, you'll know that the rules in Step 3 have opened up considerably from Step 2, according to the province. So what can I imagine? Well, firstly, I've directed Tourism London to take responsibility for the celebration, and we will have a celebration, I promise you. This is too important. And the fact that we've got case counts down, we're in Step 3, which we have not been with Sunfest and Home County and Knights Games and the Grand. So I get that, and it bites. But I will also tell you that I am optimistic about going forward, and that's why we will have a major all of London is invited event. We're planning that currently. I am not going to spoil the surprise because you would just print that in the paper and that would be wrong. So I'm not doing that. But what I will tell you is that we will provide a celebration worthy of the result. And I'll tell you, London, Ontario, the gold medal city of Canada, is damn proud of the athletes, all of our Olympians for their effort. And we are going to celebrate in the same fashion.
Thank you very much, Mayor Holder, and something to look forward to, which of course we need as we continue to work through the pandemic.
By the way, Dan, bites, I think, is a medical term, but I'll let Dr. Mackie or Carol explain that.
I will go on to the next question. Sophia Rodriguez is next up from CBC London. Dr. Mackie, over the last 2 weeks, the highest number of cases was in the 19 and under demographic. Have there been any outbreaks associated with summer camps in the region?
Yeah, thanks for the question, Sophia. Not surprising to see high cases in the younger folks. That's where vaccination rates obviously are lower when you talk about under 12 and not having a vaccine approved yet. We have been reporting summer camp outbreaks publicly for some time. We've only had one to date. I'll draw your attention and begging the permission of my moderator and co-presenters, I'll just show you on our website where that is. So if you look at the health unit, sorry, I'm just trying to get this in a useful format for you here. Oh, okay. Up at the top here, you've got, you'll be familiar with this. This is where we report all of our data. You can link through at healthunit.com. It starts out with case status. Just click over to school and childcare. That takes through cases in schools and childcare, etc. In schools, obviously, we have no outbreaks now. Schools are closed. Childcare settings, one outbreak at Pond Mills Children's Center, 2 confirmed cases. Day and overnight camps, at the moment, we have no cases and no outbreaks. However, last week, we declared over an outbreak at Temp Center Playground Program day camp. This was very small. There were only 2 cases, but because there was evidence of transmission within that setting, we did declare an outbreak and work with them around containing that, which obviously, as you can see, was well contained. There's some additional information. Post-secondary is tracked here. Student cases, school-aged versus non-school-aged population. So all of that is available on that tab for you in case it's helpful.
Thank you very much, Dr. Mackie. Let's go to a follow-up question from Sophia Rodriguez. Dr. Mackie, how concerned should we be about the rise in cases across the province? Should people still feel optimistic about loosening restrictions in the near future and going back to some sort of normal? What does this rise mean for those who have not yet been vaccinated?
Yeah, I really appreciate the question. So once again, this is a situation where the risk tolerance of our society and at the individual level will be part of the answer, and that will be different for different people. I mean, one question that we've got recently is when will we be able to take off the masks? I don't see that happening in the short term. They are, if you look at all of the ways in which we've given up our, relative freedom over the past year and a half, masking is a relatively minor imposition compared to forced closure of facilities. And so, from the public health perspective, it makes a difference. And, it allows us to operate our facilities, our economy, our society. So I think we'll see mask mandates in place for some time. In terms of other mandates, the regulations for the reopening step of the Reopening Ontario Act, which would be the next step, have been made public. They are quite permissive about indoor gatherings and basically taking the limits off. So, when that will happen depends on the current criteria are around vaccination status. The government has indicated that that won't occur until 80% of Ontarians have one dose. That's already done. 75% have 2 doses. We're on the way, but not there. And all health units in Ontario have at least 70% first doses into populations. We're not quite there in some places either. So that will take some time. When we don't exactly know. As the vaccinations, particularly moving second doses up, starts to plateau, it becomes further and further away. We become further and further away from that 75% mark. A week ago, it might have looked like we could have reached it this week. Now that looks more difficult. So we don't exactly know when we'll see further reopening or when we'll get back to normal. What does the rise mean for those who have not been vaccinated? This means there's a pandemic wave that's coming for you. Unless you get vaccinated, there's a good chance you will get pandemic sometime, as you will get the COVID-19 virus sometime in the next year.
Thank you very much, Dr. Mackie. We're going to go back to a couple of questions from Jennifer Beeman at the London Free Press for Carol Young-Ritchie. Jennifer asks, why make November 1st the effective date for the vaccine policy and not sooner?
Yeah. Thanks, Jennifer. First off, I just want to say our clinical placements are really important for our students. And what we want to do is set them up to succeed. So we have made it November, and that's in order for them to get their 2 vaccines in. Plus, after your second vaccine, a 14-day waiting period before you come in to make sure that vaccine is fully effective. So we have given some time for those students to get those vaccines in place and be ready to go. So that's why we set the date of November.
And a quick follow-up from Jennifer for you again, Carol. Is it both COVID-19 vaccine doses by November 1st? And as a healthcare partner of LHSC, is St. Joseph's also adopting this policy?
Yeah, thanks. I can't speak for St. Joe's, so we are adopting this at LHSC, and yes, it is both doses, and that the second dose is in, and there's been 2 weeks before they start the clinical placement.
Thank you very much, Carol, for that. Well, that brings us to the end of our questions for this afternoon. We'd like to thank you for taking the time to be with us, and to our panel, our distinguished panel every week, as they provide the information that we need to stay updated and on top of the latest information about COVID-19 in London and in Middlesex County. That will do it for this afternoon. We will be back with our next virtual media briefing on Thursday afternoon at 2 o'clock. So between now and then, have a great rest of your Monday afternoon. We'll see you on Thursday, and so long for now.